so good. I know, I was so starving the whole day.
So glad for a steady break.
Ugh, I need it.
Yeah, right?
Hey, Kim? Hey, are you still not feeling well?
No.
What's going on?
I just had this pain and I puked twice. I don't know. I think I should go to the doctor.
Okay, do you want me to go get the car ready?
Yeah.
Hi, Mr. Thermopoulos. My name is Dr. Chen. How are you doing today? What brings you in?
I don't feel too good. Today I had I had lunch and then I just started vomiting after a few hours and I felt this pain and then, I don't know.
I'm sorry to hear about that.
Kimberly Thermopoulos is a 26-year-old female student with recurrent right upper quadrant pain hours after eating a fatty and protein-filled meal. She's overweight and has no medical conditions or past surgeries. Though this case has many possibilities, let's focus on evaluating for the diagnosis of cholelithiasis. When considering cholelithiasis, or gallstones, one must be sure to take a thorough history, including all characteristics and timeline of pain, check vitals to be sure the patient is hemodynamically stable and afebrile, do a full abdominal exam to assess for guarding, rebound, gross distension, tenderness in all four quadrants or any quadrant, with special attention to the right upper quadrant. That includes maneuvers such as Murphy sign and assessment of size of liver and spleen. They must also send for appropriate laboratory tests, including complete metabolic panel to assess metabolic status, liver function, bilirubin levels, lipase and amylase to assess pancreatic function, and complete blood count to assess for white blood cell count and look for anemia. Request appropriate imaging, typically starting with the right upper quadrant ultrasound for initial evaluation of the gallbladder and surrounding structures, and if pathology is noted, test was indeterminate, or the symptoms still point to cholelithiasis as the most probable diagnosis, further imaging such as a HIDA scan, MRI, X-ray of the abdomen, or CT of the abdomen may be recruited. Finally, it is most important for the primary team to recruit the aid of appropriate specialist teams. In most cases, both a gastroenterologist and general surgeon will be needed to evaluate patient for expected procedures such as ERCP or elective cholecystectomy. Here's an example of Murphy sign.
Deep breath in.
Oh my god. No, sorry. I'm sorry. That really
Okay,
hurt.
I'm sorry about that. I'm sorry about that.
It's
Yeah,
okay.
okay.
Here, the patient is asked to take a deep breath as the physician pressed deeply into the right upper quadrant. The deep breath resulted in a depression of the diaphragm and thereby liver and gallbladder that allowed improved gallbladder exposure, giving the physician a greater ability to assess tenderness in the right upper quadrant. Patients with currently symptomatic cholelithiasis typically respond to this deep palpation by halting their inspiration mid-breath and perhaps even pushing the physician's hand away. But don't be offended. This is the perfect evidence you need to make a case for this diagnosis. Note that when this maneuver is done under ultrasound guidance, it is considered the most sensitive exam finding of acute symptomatic cholelithiasis.
After just asking you a few questions and also performing the physical exam, we have an idea of what it might be, but what we'd like to do is just perform a few tests in order to confirm that. Is that okay with you?
Yeah, I think that should be okay.
Okay.
I'm just hoping to feel better.
Well, that's going to be, I guess, our job to get you feeling better.
Thank you.
No problem.
In this presentation, we learned how to evaluate symptomatic cholelithiasis, what is appropriate testing, and how to perform and use Murphy sign.